Okay, now we have to be good.
Yes. No more dirty jokes.
No more dirty jokes. All right, I'm done. Game over. And Jim, forgive me because I am technologically challenged, as was witnessed during the Instagram live last week. Although I will tell you that that wasn't completely my fault. Some of that had to do with the way our system works, but
Okay.
yeah,
It all worked
so
out. It worked out.
it did work out, but I watched it. It was painful for like the first 5 minutes.
Well, you know,
Really painful.
Instagram lives are difficult because more often than not, like Wi-Fi signals, degrade the quality of the video and chop up the audio. So
Yeah.
I think all things considered, it went really well.
You know what, I'm going to agree. And for those of you who are joining us, Jim and I are just chatting about the Instagram live that I did with Patients Rising Now last Friday. So it was PWSA USA and Patients Rising Now. I was trying to use PWSA USA's Instagram account. Wasn't working out so well. I was there. Terry was talking, couldn't get in. So I ended up having to log out and log in on my personal account and go by my phone. It was fun. It was interesting. So for those of you who are joining us, that's what we're talking about.
And
So
folks, if you don't know Terry Wilcox, she can talk all by herself all day long. So it worked out fine.
and Terry Wilcox is absolutely amazing. So I'm sure a lot of you have heard about her by this time. She is what is exactly her title with Patients Rising? Jen, is it CEO, director?
She's the CEO. She's also the co-founder.
That's right.
Yeah. So Patients Rising was founded by her and her husband, Jonathan, because Terry came from a background in cancer nonprofits and cancer advocacy.
Right.
And when that organization changed, she saw an opportunity to start something that was a bit more universal, because any one of us probably knows a number of people in our family who have different diseases. So staying focused on one, while it's really important to be able to take a deep dive into an issue or advocacy, we can work with anybody, just like PWSA.
That's right.
Yeah, and so we feel really lucky to be able to meet all these great people like Stacy and Dorothea and all of you.
So we feel really lucky to be able to meet you and to have you here with us this evening. So we're going to go ahead and get started. I know it's a little bit after 8, and I appreciate everybody joining us this evening. I know it's hard. It's a weeknight. It's the middle of the week. School's starting all over the place. People are crazy. So we really appreciate this. I want to introduce everybody to Jim Selini. Jim is the Director of Patient Outreach at Patients Rising, originally from the Bronx in New York, which is where my father is originally from, or was originally from. He would have been 88 years old today. So it's a big day for us. And Jim attended Columbia University and earned his degree in creative writing. And he was also a consultant in Schools Writing Center, worked closely with writers of all levels. He's got a ton of experience. I know he's worked with some of our advocates in the past. He's definitely worked with me, has just an amazing mind and understands how to take your message, craft it, and kind of teach you how to focus it around whatever it is that you're talking about. So I'm really excited to bring Jim to our community this evening and have him talk to us a little bit about how to craft your story, about how that works. If you have questions, please feel free to put them in the Q&A. It's open. I believe the chat is open as well. So without further ado, Jim, you are on.
Hi, everybody. Thank you, Dorothea and Stacy, for having me here. I think you all thought I was doing you a favor, but this is just what I love doing all the time. So I feel like you're doing me the favor. So we're going to talk a little bit about storytelling and strategically using your story to influence legislators in particular. When we talk about storytelling, there's an important distinction we need to When I was a young writer, one of the things that I would do is I would take the contents of my mind and throw them out onto the page with very little discipline. Now, that's a really important stage of writing, but it's only the first stage. It's important because being able to share your story in an unfiltered way is really therapeutic for you. It's a good way to organize your thoughts. It's a good way to identify what your feelings are about certain things. Chronic illness patients have, and chronic illness caregivers like you all, go through a lot. And you have a lot of anecdotes, a lot of experience, a lot of heartache, some victories, some defeats. And those things have to be expressed. But they should not necessarily be expressed in a refined letter that you use to conduct advocacy. Now, why is that? If I was to tell the unfiltered story of my father's Alzheimer's disease, complete with all of the emotional breaks and everything, I think it would make you uncomfortable. It'd certainly make me uncomfortable. At the end of it, I might feel like, oh, I've gotten a lot off my chest, but I will have served really only myself. When we're talking about writing or storytelling for advocacy, we're talking about serving others. That's an important distinction. Eyelash here. So when you write for yourself, it really does serve you. When you edit in the service of others. Okay. There's a couple of fundamental principles that are worth thinking about before you start any writing project. The first thing is to understand who you're writing to. Okay. As a bad poet, as most bad poets will tell you, when you write a poem, if you put it in front of the wrong people, they're not going to appreciate it, and you're just going to further your reputation as a terrible poet. Likewise, if I have a Yelp review of my doctor's office, I probably don't want to share that with my doctor necessarily. The point is, you have to talk to a specific audience when you're telling your story. This way, you can make sure to do a few key things. You can use the language that they're going to understand. Now, I'm sure in meetings that you all have, you talk in a language that I probably would not be able to follow because you use diagnostic terms, medical terms, and some shorthand that is probably second nature to you, but completely alien to me. I wouldn't, even if I understood it, I couldn't really appreciate it. So part of the strategic act of storytelling is to make sure that you're speaking in the language that your audience is going to be able to absorb the best. Okay. In this case, we're going to use a legislative letter, or that is a letter to your congressional representative as the example of strategic storytelling. We know who we want to write to or talk to. We want to talk to our legislator. It helps to know, therefore, a little bit about who your legislator is. If some of your personal story happens to overlap with veterans issues, and your local representative is sitting on a Veterans Affairs Committee, you automatically have an in. Okay, it's good to know that. You can go to, I think it's Congress Web I'll find that and I'll get it to you.
Congress.gov.
Oh yeah, that was a hard one. If you go to congress.gov, you can learn about the different committees that your representatives are on, and it might give you some inside glance at something you may have in common with them.
Jim, I'm gonna pop in here real quick and just let our attendees know that, that's as we're approaching our fly-in for September, and we are beginning to narrow down the members of Congress that we're going to be meeting with. That's something that I'm going to be doing for all of you who are attending, is giving you an idea of what committees they're on, and giving you a brief bio of those members so that each of you can feel prepared and learn a little bit about your member. And any research you can do in addition to that will be great. Some of that will fall at the last minute, because it's very often that we don't have these meetings set up until a week or two right before the event. And that's just because that's the nature of the business. But we are going to do our best at PWSA USA to make sure that you are prepared and you know the committees that your member is on and have at least a little bit of background as to who they are. So sorry, Jim, go ahead.
No, that's totally cool. And a footnote, Dorothy, if you need help with that, please ask us for help over at
Okay,
Patient.
done.
We have a lot of that information compiled already.
Perfect.
So we may be able to save you a little bit of labor.
Thank you.
Sure, anytime. Right, so once you know who you're talking to and know a little bit about your reader, your audience, you can put some things into your writing that can leverage those connections, if there are any. But even if there are not, the first thing you need to do once you know your audience is you need to be able to make some kind of connection with them. So whether you have things in common with them or not, your best bet is to open a letter to them with something that's going to really grab their attention. I'm using letter writing as an example here, but at your fly-in, of course, you're going to be speaking to them in the office, right? All these principles are essentially the same. When you sit down in a representative's office, you're going to introduce yourself. And in the process of doing that, you're going to say, you're going to hook them, all right? You have to grab their attention. I was on my way to your office, I was bit by a dog. And I don't know, that's a really terrible example. The point being, say something that makes them pay attention. By the time you sit down with them, they may have had a long day already. So be polite and say something that is unexpected. Okay. But then when you introduce yourself, you want to let them know who you are and why you're addressing them. I'm Jim Selini. I'm here to talk to you about the step therapy bill, HR such and such. It's good to use those numbers, by the way, because it helps them focus on exactly what you're talking about. Don't give them room to wander, because they will. Keep them focused. If you stay focused, they stay focused. You introduce yourself, you say why you're there. Essentially, you're looping the beginning of your statement to the end of your statement. Because at the end of your statement, you're going to make this call to action. I need you. My entire organization needs you to get behind HR such and such, because that's how we're going to save the lives of our children. Okay, so that's at the beginning and it's at the end. So let's talk a little bit about what happens in the middle. There's really there's three main principles for winning hearts and minds. Okay. One is to establish yourself as a reliable storyteller. If I say on my way to your office, I was bit by a dog, but everything's fine, it kind of sounds like I'm making that up. And most people will pick up on that. So what you want to be able to do is you need to attach yourself to this venerable organization that you belong to. My name is Steve, and I've been a member of the Prader-Willi syndrome of, sorry, I'm not going to get the whole name right. I've been a member of the Prader-Willi Syndrome Association of America for 7 years. I and 14,000 other people are here to talk to you about the same issue, this issue. So now you're not just an individual, you're part of a collective. And that means they listen more because there are more voices behind your voice. If you just go in and say, I'm Steve, they might want to help Steve, but they're much more likely to help Steve and his 14,000 friends. So once you've done that, you've established yourself as with some measure of authority. Wouldn't hurt here to say, I'm the parent of a child with this disease, and I've been working every day to make this okay. It's 7 years now. So you're establishing that you're not new to the game. You've been around for a while and you know what you're talking about. Then when you take your next step, which is to make an emotional connection with another human being. All right, they already know a little bit about you, your name, where you're from. If ideally you're a constituent in their congressional district, that automatically levels you way up. But now you're a person and you're about to make a really intimate connection with another human being. And this is where you have to tap in to the heartbreak in your story, the things that are hard to talk about sometimes. I'm afraid that my child is going to die. And because you've done your research and Dorothy has helped you do that, I know that you have grandkids, so you can understand this concern of mine. We have to protect the young people in our lives who can't protect themselves. We have to offer them that guidance. And if you're doing this live, leave a little room for the air in the room to circulate. A little pause here and there gives them a chance to absorb what you're saying in an impactful way. But the takeaway from this is to make sure that you, a human being, are talking to them, a human being, not a representative of another political party, not some old white guy in a suit, not that guy who supports this or that legislation. You're talking to somebody who went into politics to try to make the world a better place. So you're there for the same reasons. You're just bringing something to their attention that they might not already know. And that's where you can make your connection. Okay. Now I'm going to pause here for just a minute. I usually just listen to my own voice, and if I start getting dry, it means I've been talking too much. So I'm going to leave a little space in the room for the air to circulate. And if anybody has any questions, I'm very happy to answer them.
I don't see anything in the chat, but folks, please feel free to chime in. We want this to be as much of a dialogue as possible. And I think that Jim has brought some really great points to the table about making a connection, establishing yourself as a reliable source. Yes, absolutely. And then going that next step and making that emotional connection, and really being able to tap into what that person is feeling. So I know that earlier this afternoon, our advocacy work group had a meeting, and one of our members was really talking about, she says, I have so many stories and they're incredible. They don't they don't sound real. They sound like impossible realities, but this is the world that I'm living in, and I don't know which one to pick. And I said, well, you know, we talked about this for a little bit, and finally, you know, I just said, pick the one that's most impactful. These are real stories. These are things that are actually happening to you, and there's things that we can tie them back into. So, for example, one of the things that we're going to be discussing is a bill that was just filed, that PWSA USA's been lucky enough to be involved in developing, and it's called the Rare Disease Clinical Trial Pandemic Disruption Act. And it's been sponsored by Representative Gottheimer. It's House Resolution 8641. We've got 2 co-sponsors already. It's bipartisan support. And this is something that is close to our community because it allows pharmaceutical companies the ability, it will give them the ability to have 6 months of additional exclusivity when their drug comes to market. And I think those of us in our community can really take this to heart because we've had so much, COVID has impacted our community and the companies that are developing orphan drugs for our community deeply over these past few years. We've lost a few pharmaceutical companies, Jim, as you know, because I was making a big stink about it in DC. But we've actually come up with a piece of legislation that gives not just PWSA the opportunity to try to help these companies, but this is something tangible. This is something that can actually happen, and we can use the stories of what our families have dealt with through COVID, and what, you know, many families throughout the rest of the country experience for the first time during COVID is what so many of our families deal with on a daily basis and have been for years. We can very easily take some of our stories and tie them back to something like this. So when you're trying to make an emotional connection like that, I think it's just about taking our reality and trying to figure out a way to make the connection where it's, you know, it's now the reality of so many people that they never would have been able to imagine it prior to COVID. So I think we have the opportunity to really relate to some of these elected officials.
Such an excellent point. No, those are super excellent points. And that ability to make a connection really changes the tone of the conversation. I've been in meetings with legislators where, you know, it felt very robotic. You know, I'm there to say this, they're there to nod and listen. 20 minutes later, you're done and you leave. Maybe you take a picture outside the office or something for posterity. But those aren't the meetings that you remember because they're not the meetings they remember. So you have to give them something memorable. I know we started talking about writing, but let's abandon that for the time being. Because you have an opportunity to speak in person with legislators, let's focus a little more on that. Bring your iPad with you and be prepared to show a 10-second video that is going to bridge the abstract that you're trying to explain and show them the reality. Okay, because then this isn't just people in my office talking. They're representing, these are real kids here, you know, and you automatically have their attention, right? And you're very likely to hold on to it for that really short period of time that you guys are going to be meeting. So having photos is great, videos are better. Let them see who you're fighting for. Okay, because then they can put themselves in your shoes. Yeah, I'm going to fight for them too.
So Jim, on that note, I just want to elaborate and maybe dive into that a little bit. You know that when I joined Patients Rising in DC in June, that I brought my husband and we brought our son with us. And we also had another member of our organization, Charles Conway, who had his entire family there as well. I know as an organization, we have several families who are going to be bringing either, a spouse or their loved one that has PWS. And can you maybe discuss how that might be impactful? I know that for us, it was definitely challenging for us as a family to do that. But as we met with different offices, the impact that it made to have this person with PWS actually present with us, I really can't put into words some of the responses that we got from doing that. Can you maybe speak to that a little bit?
Yeah. Well, if you have, if you're able to bring your kids with you and other caregivers, I think, yeah, that's going to make an impression that can't be matched in any other way. And yet, I'm going to also push back against that idea a little bit. When you bring your family with you into these offices, the impulse is to keep everyone on their best behavior, but that might not be the reality of what you live with. So maybe you could do both. You could have your family with you, but you can also have a video that shows the less pretty side of what you're there fighting for. Okay. This way, you're not asking your child to perform for someone. They're just there being themselves. But you can also show some other side that they don't get to see right in that moment.
So allow the meltdowns.
Yeah, exactly. Because then they're going to be able to see the issues on your level a little bit more clearly. So that's a fantastic way to make a connection, I think. I think you have an excellent opportunity to be able to do that in a way that someone with invisible illnesses isn't going to be able to do as well. Now, once you've made that connection, the next thing you need to do is you need to make a good logical argument, because your legislator is someone who's going to have to argue their point to their colleagues. So they need some information. They need to know some basic statistics, like how many people are living with this disease, how many families does it affect, and how many people do all those families represent, right? What is the financial burden of this disease?
So Jim, can I ask you a question on that? And this is Dorothea, mom of Hunter, asking this question. Would it be better for us to present it as how PWS, how many people in the United States PWS is affecting? I mean, we know it's 1 in every 15,000 live births, et cetera, et cetera. Or would it be more effective to present it as this is one of over 7,000 rare diseases, and 1 out of 10 people has a rare disease? So we represent, a group of 30 million Americans who are suffering with rare disease. I mean, what would be the most effective way for us as an organization and as representatives of PWS to get this point across?
That's a great question, because it comes back to what are the things that you can express in this meeting that are going to have the most impact. Okay. Now, it depends a little bit on the legislation that you're trying to get supported. Okay. If there's something in that legislation that's specific to PWS, then I would keep the focus on PWS. But if it's more about rare disease research and orphan drug development, then yes, widen the conversation to the larger rare disease community in the US. There's something that really connects with people about rare disease, and that is because it's rare, there is not as much financial incentive for a company to develop a cure or treatment. And this is basically the heart of the argument about why we don't want to make it harder for drug companies to develop treatments. I'm not going to be the person to run to the defense of the pharmaceutical industry ever, but I mean, the truth is that's where treatments come from, right? So depending on the specifics of your legislation, your point needs to be clear that we want to do everything we can to ease the process of developing treatments for a disease that has otherwise gone untreated, underserved. There are some key words like untreated, underserved. This is part of the language of your audience, okay? And as a matter of fact, talking about that language, I would give you all a little bit of homework, and that is to read the wording of other statements about rare diseases that have come out of some politician's office, and look for some of the key words that you can then reiterate in your statements, because then you'll be talking their language. Yes.
Where would be the best place where we would be able to find some of those keywords?
Usually right on congress.gov. On each representative's page, they will usually be happy to share every media event that went well for them right there on their page. So you'll be able to see a lot of the wording that they have used. If you're fortunate enough that they've talked about rare disease or anything in the healthcare space, then you'll be able to pick up on some of their language. If you're talking to a representative who has not had anything to do with healthcare at all, that's okay, because the language is the same across all the offices. So if you find one good statement on rare disease from someone, you'll be able to pick up on the things that they repeat over and over. And those are going to be the key words that are they're going to hit little buttons in their brains as you say them. And so that can be powerful, another way of helping them understand the abstract in a way that they can understand. Okay. Innovation is a hot word for the rare disease space. We don't want to stifle innovation, right? Look for other words like that. They may be helpful to you. Use them judiciously. Don't just go in there and regurgitate what they've said, although that would probably excite them a little bit.
And for those of you who are listening and those of you who are able to watch afterwards, one of the things that we've done at PWSA is you will be receiving this if you're going to the fly-in. We have put together a list of the ranking members of, like the Energy and Commerce Committee, which deals with a lot of the healthcare issues, a lot of the different agencies, the Rare Disease Congressional Caucus, which spans over between the House and the Senate, and is bipartisan. And we have, the Twitter handles and Facebook pages and LinkedIn and Instagram and all that stuff. So you all would be able to tap into their social media worlds and follow them where they are in their space. So I think that might actually be a good place for us to pick up on some of those keywords too also, right, Jim?
Oh yeah, for sure.
Okay.
And can I just take a second here to say to the audience here, you have such a good team behind you here. I've worked with a lot of organizations. Very few, almost none, have the dedication and the willingness to learn and share what they learn with their audience at large. So I hope you can appreciate the dedication you're getting out of these incredible people. But I don't want to embarrass anybody anymore.
Oh, thanks, Jim. We have a question in the chat. I'm trying to make sure I'm understanding it correctly. So I'm all about doing my homework. How much notice will we have about the representatives or aides that we might have an opportunity to connect with? Oh, Michelle, I love you. I have to tell you, I don't know if we can officially answer that question. You worded it perfectly. Don't worry. I got it. Sometimes these meetings come up to the minute, right? Sometimes these meetings, you don't know if you're going to have them until a week or 2 weeks before. So we have requested, we've taken everybody who is coming to the fly-in, and we have made special requests. Those requests, we're 6 weeks out. Those requests are going out this week. So over the next 2 weeks, we'll start to get a handle on who's receptive. But I'm just going to be honest with you and say that it could be as soon as 2 weeks out before we know exactly who we're going to meet with. And to be 100% transparent, even the week or days before those meetings, those times and those numbers can change. So we will do our best to try to prepare everyone. But these member offices usually don't plan further than 2 to 3 weeks out, even for speaking engagements. So it's a little bit difficult to plan, but we will do our best. And the folks that we're working with who are helping us plan these meetings have everybody's congressional members. They know everybody's address, and we're working really hard to ensure that we're able to meet with district members. So we're working on it. And there is a very good chance that you'll not only meet with somebody that's representing your state or your House district, but that you're going to meet with other members of Congress too, because we will in teams of probably 5 or 6 people, and then a team leader meeting with areas of the United States. So we will do our best, but it will come down to the wire. And just please know that there's nothing we can do about that, but just go along with it and push forward. Jim knows. He's done this quite a long time, and recently just went through it post-COVID with Patients Rising Now. And I can tell you that we were there the morning of, and meetings were changing and meetings were getting added to the schedule at the last minute. So some of it is going to be fly by the seat of your pants, but for the bulk of it, we'll have a generally a good idea of who we're meeting with. So I hope that answers a little bit of your question. Jim, you're on mute.
Important to remember too. Sorry, at least I didn't go on for 5 minutes like I did last week. That knowing who you're talking to is helpful, but if you have a well-prepared elevator pitch, you can give that to anybody.
Right.
So if you do the parts that you can do, you can tweak it at the end with a little personalized information, but you need to have that structure to attach those last minute bits to, okay? So I think we were talking about, right, making your argument. Okay, so you've introduced yourself, you've made some emotional connection. Now you got to talk about the nuts and bolts. This is how you can fix this thing. Or these are some of the day-to-day problems that we face that need to be addressed, and the obvious reasons why they need to be addressed. Don't be obscure, be really blunt. They can take it and they can appreciate it. You know, if you say that there is currently no law that protects my ability to bring medical supplies into my home or whatever, we need to fix that problem, then that's a really clear nuts and bolts approach to you having a problem and them being able to do something potentially to fix it. Because you have to draw them a map, right? You've been kind enough to introduce yourself. You've been kind enough to make a personal connection with them. Now you have to be kind enough to make their job as easy as possible by giving them the steps that they can take. Ideally, they don't have to think. You've done all the thinking. If you take these steps, take a left over here and you take a right over there and continue for 2 blocks, and you'll get at the solution, you've probably increased the likelihood that they're going to act on your appeal considerably. Because if they have to stop and research and do work, they're going to get distracted. They're going to maybe drop the ball. Happens all the time, right? So you've got to put crazy glue on the ball so they can't lose it. Keep them from getting distracted by leaving really clear steps in your story, in your appeal, as to how they can solve the problem. It might be as simple as, this legislation is on the table. What I really need to do is get you to get this passed, turn it into a law, support it. Right? Sometimes that's all they can do, but oftentimes it's enough. If we get enough support for a bill, it usually will get passed into law. So that's sort of how we loop the beginning to the end. We end with the same place we started. This is why I've come to talk to you. This is what I need you to do, because if you can do this, you can XYZ. You can save my family. You can keep us from having to sell our house in order to afford medication. You can keep me from having to move back into my parents' garage. Usually these things do circle around money, but you know best the things that are really sensitive to your needs, that you can make the pin of the argument. Okay. During one of my, I'm sorry, I'm going to read a comment.
Yeah, I was about to do that. Stacy says, during one of my meetings with a congressman, he said, tell me what you want me to do and I'll do it. Just so, I mean, and I think the point of that is just, if you make it easy and you do the homework and you say, listen, this is, if you do this, if you co-sponsor this bill, if you support this piece of legislation, if you get this condition added to a specific list, this will help my family. It's, give them a job. That's what they're there for.
Yeah, because oftentimes, just like any one of us, we're faced with a problem in life, but we haven't got any idea how to get to the finish line, how to fix it. So if you do all that thinking for them and say, yeah, if you do A, B, and C, you could make a world of difference for my family, then Stacy, you're right. That's a great way to save them extra work, which means you're more likely to get what you need. Okay. And that's again the connection between the beginning and the end. Right? I'm going to take you on a walk, and at the end, we're going to arrive at McDonald's. And then at the end, you say, here we are at McDonald's, and this is why I brought you here. So the end and the beginning always have to stay connected, so that they see that everything in the middle was the argument for why we took this walk, why we ended up where we are. I don't know if that's being too obscure, but hopefully that's clear. You're trying to make a finite loop of an argument. And everything in the middle is everything you need to convince them that your argument is valid and that they should support you. And that's really all I have to share with you. Well, we can talk about anything, of course, but that's good storytelling in a nutshell. Okay.
And that's absolutely perfect, Jen. Thank you so much. I think, listen, for me, it's very helpful. And I hope it's very helpful for all of you who are watching and able to join us this evening. Over the next few weeks, I know that we're meeting with the team leaders next week, and I'm going to be opening this up the week after for office hours. So I believe the week after next, what we're going to do is have a general meeting for all of the attendees, which will be an informational meeting, and walk you through what our ask is, take you through the platform. And then from there, open it up for the office hours, and whoever has questions, wants to work through their story, maybe isn't sure as to how they want to present or where they're going to present. That's what we're here for. That's what we're here for. That's what I'm here for, to kind of help guide you and take you through a lot of the principles that Jim's lined out for us this evening. And I want to kind of go back to where he started, which is funny after listening to the whole presentation, because the end always ties back into the beginning. This is therapeutic. It's cathartic for many of us to be able to share our stories. It's emotional. It's hard. It's hard to tell your story and tie it back in without getting emotional. It definitely takes some time before that can happen, but that's okay. So, I find that the more I talk about our story, our personal family story, um, the easier it becomes, and the easier it becomes to kind of just go through it, and feel all of those emotions, and people are receptive for that, and people want to help, and our stories as a community are bipartisan. This is not a disease that picks and chooses who it's going to affect. And I think that resonates with people in general. And at the end of the day, elected officials and their staff, they're people. They eat, they breathe, they sleep, just like you and I do. They have lives, they've had trauma, they've had happiness, they've had sadness. So if we can take our stories and tap into those emotions, I think that there's a way for us to be really effective there. So that's just my spiel. But yes, we will be here to guide everybody. And I know that people are a little bit nervous, a little bit antsy. We have a lot of people who've never done this before. But I promise you'll tell your story once and you will never stop telling it.
That's so true. You get kind of hooked on this because you realize that you have been through things that when you share them, you can move other people to action. And that's incredibly powerful. It takes you away from passive caregiving to active advocacy, where you can see changes happening based on your actions. And that's pretty cool. Now, Dorothy, you said that there's a lot of people who are going to be attending this who've never done anything like this before.
So I think that the majority of the folks that are attending have never done something like this before. If I'm looking through the list correctly, 3/4 of the folks who are joining us have never had the opportunity to do something like this in person before.
Do you mind if I share a couple of insights I got from working with other newbies?
Not at all. Please go right ahead.
Okay. Well, one of the things that came up a lot when I was working with patients for our fly-in who had never done this before, they would often say, well, I mean, my story, I could talk about everything I've been through for days and days. How do I pick what I'm going to talk about? And that again is a strategic choice. Okay. If you're going to talk about the importance of supporting rare disease legislation, then you want to talk about some of the parts of your story that highlight the downside of being rare. The fact that you may have to travel 4 hours, or you have to get on a plane to find a doctor who specializes in your needs. Okay. Think about the part of your story. Maybe there was one day, maybe it was your worst day, or maybe it was your best day, where something happened that really changed the whole way you saw your life living with this disease. There could be something from that emotional period. Like, I had to pull off the highway. I was on the side of the road. I was bawling my eyes out. I threw my phone in the river. I couldn't take it anymore. But then I realized I'm not in this by myself. I have my organization at my back. I've got my family and friends. Moments like that can really, in a very few number of words, have a huge impact in your storytelling. Okay? Because it creates drama, and it has the advantage of being real and true. So when you're looking through what you want to say, think of those dramatic moments, those game-changing, corner-turning moments. And I strongly recommend that you don't do this by yourself. Work with a partner. Talk out loud about your story. Right? Write something down and get one of your peers to read it and ask them, what is this? Is this weak? Is this strong? Is this good? What do I do with this? Rely on each other, because nobody knows this issue better than all of you. All right? So you'll know what's strong, what's not. what's appropriate for this kind of discussion. And if you think you're too inside it to really see, can't see the forest for the trees, ask me for help and I'll read what you have to write. I'll listen to what you have to say. Sorry, I'm joining your
I love it. No, thank you. I love it, Jim. Thank you.
I make myself here. I'm going to just put my email.
Put your information. I was about to say, put your information in the chat. Get ready.
Mm-hmm.
You're going to get bombarded.
That's cool. I'm all for it.
And folks, just so you know, we have advocates within the community who have worked with Jim before. He's fantastic, extremely effective. And, you know, I think working through some of these things with him, you know, sometimes it's helpful to have somebody who understands a little bit of the rare story, but maybe not the particular PWS story, to kind of bounce your ideas and your story off of, because it provides a little bit of extra perspective or a different perspective. So, you know, he's putting his information in the chat. Use it.
You can think of me. I couldn't even get the name of your organization correct earlier. Maybe I should have had that third cup of coffee.
Don't worry about it. Listen, we get called Prader-Willi syndrome, gets called Prader-Willi, Prader-Willi, PWS. I mean, just, you know, don't call us late. Okay. We're good. We're good.
But I mean, if you send me your stories or ideas, remember, I'm kind of like the politicians you're going to be speaking to. I don't really understand this disease very well, I'll be honest. I get rare diseases. I've worked in the rare disease space, but I don't know the nuances of this. Can I ask what Jim's connection and interest in Patience Rising is? Curious about his story. Oh.
So we want to hear your story, Jim.
Oh boy.
Okay. Oh boy. Dun, dun, dun.
It was 1967. No.
Sorry.
But no, but a little bit, yeah, because when I was a little kid, my mom worked in a nursing home and she insisted that I become a candy striper as soon as I was able to do that. So I've been working in patient spaces my whole life. And yes, I was born in 1967, so I've been doing this for a little while. I'm a medical assistant, so I've worked in doctors' offices. I've worked in university hospitals, surgery departments, gastroenterology departments, orthopedics, all kinds of places. And I did a 20-year stint at Columbia University as a clinical trial coordinator, where I was working specifically with rare disease populations. So that's where I learned the painful realities of being rare. You know, we all like to think that we're unique, but we don't really like being rare. It doesn't really come with a lot of advantages. Right? And in the background of all this, I've always been a writer. So I studied writing and realized that there was an intersection in what I loved to do with this hand and what I loved to do with that hand. So I decided to put writing and patient community building and support together. And now at Patience Rising, I'm all about supporting patients using platforms to express themselves, whether that's that cathartic personal expression or strategic external advocacy type expressions. It's all valid. It's all art. It's all a little bit of science, and it all matters. And that's what I do with Patience Rising. I'm just so lucky that they actually let me just be me. I'm not good at boundaries, which is why I gave you all my email. Why did I do that? Yes.
I feel you, Jim.
Just don't know where to say enough. So please take advantage of my pathology and use me however you need to, okay? I'm at the service of the organization. Patience Rising exists to support other organizations, all disease states, all patients, caregivers, advocates everywhere in the US. We're not international. We have enough problems in the US. We don't have to be. So Jamie, I hope I answered your question. And you can ask me other questions anytime you want, now that you have my email. You can also, I run the Patients Rising Instagram account. So if you DM Patients Rising, you're really DMing me. So
can you put the Patients Rising Instagram account in the chat also, so folks who want to follow can?
Yeah. I'll put it as a link.
Thank you. I would do it. I don't know how. It's pathetic. I get confused with hashtags and the @ symbol and trying to figure out how both of those work and interplay with it. It's really, I'm pathetic.
You're still learning hashtags, Dorothea?
Stop. I need like a 15-year-old to sit me down and school me on how all of these things work.
Well, I'm pretending that I know how they work. I just fake it until somebody calls me on it. So I don't know.
Well, you saw how that worked out for me on Friday. It didn't work out so well. I was like, I can do this. And I was in there 10 minutes early thinking I could do it. It just didn't work.
Technology, I'm still so talking on mute. We've been doing this for years now.
Right.
But I really do extend to all of you. Anything you need, really consider me part of the organization, because our hearts are all working towards the same thing. And Patients Rising exists to help you. So
and we love you.
We
Thank you.
You guys too. You guys are the best.
Thank you. Thank you so much, Jim. So guys, if you all have any questions, you have Jim's information. You can reach out to him directly. Stay tuned to your emails. Those of you who are going to be coming to the fly-in, we'll be sending out the preliminary agenda by the end of this week. So you have an overview of what we're going to be doing. As far as the specific meetings, stay tuned. We will have an app with all of the information available to all of you as we get closer to the actual fly-in. So when we have the meeting as a group, we'll be able to give you all of that information as well. And in the meantime, Jim is available to help you with your stories. I'm available to help you with your stories. Stacy has herself on mute and she's not showing herself, but she's available to help you with your stories. We are all here. So just hang in there, and thank you so much for joining us this evening and taking time out of your schedules to be with us and to meet with Jim. We're really happy that you were able to join us, Jim. Thank you so much.
You're so welcome. Thank you, everybody, for being here for this. If this is your first time doing a fly-in and talking to legislators on the Hill, it's okay to be nervous, but you're going to crush this. I believe in you.
You see, and I tell people, don't let your fear guide you. If you're going to let your fear do anything, let it propel you into what it is that we're going to do. So take those nerves and just make them push you in the right direction. We'll get it done.
Good luck, everybody.
All right. Thanks, guys. Thank you. All right. Have a good night.
All right. Bye, everyone.
Thanks, Jeff.